This bill was introduced by Representative Brad Wenstrup, a Republican from Ohio. There are 60 co-sponsors with this piece of legislation. As we well know, the Home Rule Act of 1973 establishes the procedure whereby Congress can disapprove any act passed by the Council by passing a joint resolution of disapproval within 30 legislative days. House Joint Resolution 27 would employ this procedure to express Congress's disapproval of the Death with Dignity Act of 2016. On December 19th of last year, the district enacted a bill legalizing assisted suicide in our nation's capital. The bill, hastily passed after only a single public hearing, had serious flaws that placed individuals in a position ripe for abuse and mistake. My concerns about the dangerous flaw in the district's act are shared by a number of people, and I will tell you it's of deep personal, moral conviction that I stand in opposition of what has passed and therefore in favor of this resolution of disapproval. And as chairman of this committee, I did not ask for this to come to me, but per the Constitution and the Home Rule Act, it does come to the chairman of the Oversight Committee, and I have to make decisions on a regular basis as to what will be considered and what is not considered. The overwhelming majority of things that come to our desk are not considered, but I think this is an important enough that our committee should have this markup here today. One of the other people who is concerned about this is a member of the mayor's director of the Department of Health, Dr. LaQuandra Nesbitt. Dr. Nesbitt expressed deep reservations about legalizing assisted suicide in the district. Dr. Nesbitt's concerns range from the American Medical Association's opposition to assisted suicide to the potential for abuse and mistakes when carrying out assisted suicide. Even the most basic alleged safeguard that assisted suicide is limited to those with a terminal prognosis of 6 months or less creates unnecessary risks. Dr. Nesbitt herself noted the difficulty and potential inaccuracy that exists in predicting a terminal prognosis for a patient. In fact, the National Institutes of Health highlighted one study of doctors' accuracy when predicting how long a patient might live with the terminal illness and found the prediction was correct a paltry 20% of the time, meaning life expectancy predictions were incorrect about 80% of the time. When only 1 in 5 predictions are correct, this quote-unquote 6 months to live, end quote, prognosis hardly seems a foolproof measure to prevent abuse or mistakes, especially when the outcomes of the mistake cannot be undone. The District's Act does not even make clear what can be considered a terminal disease. The singular requirement is a reasonable medical judgment that will result in death within 6 months. Does this mean that you'll probably die if you outlive your life expectancy? For a male, it's 76 years old. For a female, it's 81 years old. Statistically, you're predicted to die within 6 months of that. With no set definition, we cannot know what types of illnesses are permitted under the district's laws. Disease and illnesses that are otherwise non-terminal with medication may now become eligible for assisted suicide. Nothing exists in law to prevent a doctor from prescribing assisted suicide medication to a person, for instance, with diabetes or AIDS, both of which can be made non-terminal disease with treatment that wasn't available some 20-plus years ago. I also have not highlighted what a Class A felony is. This law seems to be a photocopy of what was done in the state of Washington, where the state of Washington has laid out specifically what a Class A felony is. That is a different system in Washington, D.C., and so under this table of penalties, there is no penalty for assisted suicide if it falls outside the bounds of this, of what this bill is trying to do. Along with Dr. Nesbitt, I have serious reservations and concerns about the level of supervision required under the Act. Far too many of its quote-unquote safeguards appear to be little more than a facade of protection rather than actual measures to combat abuse and misuse. The Act places individuals in a situation ripe for coercion and misuse or mistakes. Under the District's Act, there is no requirement that an individual be evaluated by a specialist for depression or capacity to make the irreversible decision to end his or her life. Instead, the Act allows individuals or doctors who may have only just met the patient to certify that the choice to utilize assisted suicide is voluntary and made with a with a sound mind. Not only that, but the Act permits an individual with a financial interest in the death of the patient, such as a potential heir, to act as a certifying witness that no coercion has taken place. Despite this, the Act requires no supervision by a medical professional when a patient takes the drugs meant to end his or her life. None of the district's proposed safeguards appear to be able to prevent an irreversible death by mistake or abuse. I wonder whether using prescription drugs to end life rather than treat the illness is compliant with the Controlled Substances Act. A serious question moving forward. The legalization of assisted suicide in the nation's capital stands in stark contrast to the federal government's effort to prevent suicide. The federal government has been deeply involved in suicide prevention. In fiscal year 2015, the Department of Health and Human Services budget included $55 million for suicide prevention efforts. I'm sure those on this panel who want to have assisted suicide will fight to have that stripped from the budget. The National Institutes of Health has spent more than $250 million since 2012 studying suicide and how to prevent it. And again, I'm sure that those who believe in assisted suicide will fight that funding as well. At least they should if they're going to be consistent. Suicide rates have increased 24% since 1999, and we should be doing everything in our power as legislators to help prevent suicide, not encourage it. I worry that assisted suicide will create a marketplace for death. It is appalling and heartbreaking that insurers in states that allow physician-assisted suicide sometimes deny insurance coverage for life-saving treatments, but grant coverage for drugs to commit suicide. Stories like those should be cause for immediate pause when considering legalized suicide. The Congressional Budget Office determined that this resolution would increase spending because more people would survive and need Medicare and Medicaid assistance. The implication is that suicide saves the government money. In fact, legalizing assisted suicide would save an estimated $1.5 million otherwise spent on extending people's lives, according to the Congressional Budget Office. The idea that we would treat a human being's survival as an economic cost is both morbid and antithetical to the basic societal values. Our country should never facilitate, encourage, or tacitly accept measures that permanently or prematurely end the lives of its people. The federal government has also spoken when it comes to assisted suicide and the federal government's involvement in this act. In fact, in 1997, prior to my being in Congress, but in 1997, President Clinton, with the support of a number of my Democratic colleagues in this room, signed the Assisted Suicide Funding Restriction Act. They voted in favor of a bill that prohibits federal dollars from being used to pay for assisted suicide or even advocating for its legalization, something that they now champion today. My mother, I talk about my dad. My mom fought cancer, breast cancer, for some 10 years before it took her life. My dad didn't get a checkup, should have, and he fought a battle with colon cancer. If he had any sort of checkup, he'd probably still be alive today. He didn't do that, and it was hard to watch him pass. And it was hard, and it was difficult. And we all have different approaches to this, and I want to respect those who differ from my viewpoint and my perspective. But I can tell you from my heart of hearts that that time, as difficult as it was, watching a parent die with a terminal disease is also one of the greatest blessings in my life, because I got to know my parents in a loving and caring way that I would have never done otherwise. And it's tough. It is growing up like nobody should have to grow up. Some of you in this audience have been through it. Cancer kills 1,500 people a day. And I will stand arm in arm with anybody who wants to increase the funding to fight and beat cancer. To my mind, it's a crying shame how little money our federal government spends on a disease that's killing 1,500 people a day. But I will also stand arm in arm with those that want to fight against the expansion of assisted suicide. I think it's fundamentally wrong. But I respect those who disagree with me, and that's why we're going to have this markup today. And with that, I will yield back and now recognize the ranking member, Mr. Cummings.